Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Birds Lake has seen 25% of the time for its emergency room closed just this year alone. It is an hour and a half to the nearest facilities. Will the Premier please explain why that is acceptable health care for rural BC?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the Leader of the Opposition for the question. Anytime an emergency room is temporarily closed, where people need to be diverted to the closest place, is a very serious issue. It has a huge impact on communities. And I know that people want to have confidence in the system, to know that the emergency services are there for them when they need it. Mr. Speaker, we are experiencing a lot of strain in the healthcare system right now. We have a global shortage of healthcare workers, and that's why it's incumbent on us to do everything possible to train and recruit new doctors to our province, to hire more nurses and more healthcare workers across the system so that we can deal with the types of staff shortages that we have been seeing. Mr. Speaker, we are going to continue this work, and I'm sure I'll have a chance to talk more about it in a moment. Thank you.
Member for Fraser-Nicola.
Sorry. I'd like to apologize, but I won't. Nicola Valley Hospital in my riding, the ER has been closed for over 26 days in this past year. To the Premier, when will hospital closures stop in British Columbia?
Minister.
Thank you, Honourable Speaker. I had the opportunity to speak with the Mayor of Merritt just yesterday, and we have spoken several times, as well as myself with many other mayors in rural areas where we're experiencing these shortages. Mr. Speaker, we are going to continue this work to fast-track the credentialing of internationally trained doctors, to build a new medical school in Surrey, to train new doctors to work here in British Columbia. Mr. Speaker, to continue the work that we have to do to bolster and build our healthcare workforce so that we are not experiencing these kinds of closures anymore. Health authorities do everything possible they can, working with physicians in the region to mitigate and avoid these kinds of closures. And Mr. Speaker, we're going to continue to support health authorities in that work. We're going to continue to strengthen and attract and build this workforce because, Mr. Speaker, we know that particularly in rural communities, but in communities across British Columbia, people need to have a system that is there for them when they need it, where they need it. Thank you, Mr. Speaker.
House Leader of Third Party.
Over and over again, this government has shirked responsibility and left local governments to pick up the slack. Southern Vancouver Island municipalities are deeply concerned about paying the full cost of 911 emergency dispatch services. On April 1st, these 10 municipalities will be responsible for covering the entire estimated $5 million cost of ECOM 911 services in their region. My question, Honourable Speaker, is to the Minister of Public Safety and Solicitor General. While we await the provincial review of ECOM services, will you commit to providing $5 million of transitional funding to cover South Island emergency dispatch services?
Solicitor General and Minister of Public Safety.
Thank you, Mr. Speaker, and thank you to the member opposite for the question. The responsibility for 911 services in British Columbia is purely the responsibility of the local government. It's delegated by the province through agreements like the Municipal Policing Agreement and the Provincial Policing Agreement. This applies regardless of whether a community is served by the RCMP or a local police detachment. South Island communities here on the island were informed in December 2022, 5 years in advance of starting this on March 21st, 2025, that they would be responsible for covering 100% of the costs associated with dispatching. We provide these municipalities with multi-year transitional funding to fully cover the police dispatch service until March 31st, 2025, with the understanding that the province and municipalities would then assume responsibility for funding at that point.
Thank you, Minister.
This traditional funding provided communities with over 3 years of additional funding. Thank you, Mr. Speaker.
Members, supplemental?
These 10 municipalities are currently finishing their 2025 budgets and are being forced to consider raising taxes by 3 to 6% to cover the downloaded 911 emergency dispatch services, a cost, I should note, that is covered by provincial and federal funding in all other parts of the province. This is a matter of equity. Through you, Honourable Speaker, again to the Minister of Public Safety and Solicitor General, will you make it a priority to work with these 10 municipalities to develop an equitable funding formula for South Island emergency dispatch funding?
Minister.
Mr. Speaker, you should know that we have contracted, that is, the Ministry of the Solicitor General has contracted a review of ECOM's financial sustainability, operational capacity, and government structure, and we will be making recommendations based upon that study and the future of 911 service in this province. ECOM and 911 services safety will not be impacted. Additionally, it has been communicated that there must be no impact or disruption of service. As the review is underway, communities will continue to be responsible for paying for the ECOM services they receive on call taking and dispatch services.
Thank you. Member for Boundary Similkameen.
The emergency room in Karamias has been closed evenings and weekends for 1,213 days. Why does this Premier think that this is acceptable?
Minister of Health.
Thank you, Honourable Speaker, and thank you to the member for the question. In Boundary, Similkameen, or in any riding across this province, people need to know that emergency services are there for them, that the emergency rooms are open for people. Mr. Speaker, there's a lot of work to do to strengthen our healthcare system, and that's why we have been taking action for years in building and bolstering that healthcare workforce that we know is in the context of a global healthcare worker shortage. Mr. Speaker, British Columbia is not alone in experiencing these challenges. In addition to the work that we're doing to train new doctors, to attract new doctors, to hire more nurses, Mr. Speaker, we're also alleviating the strain that is felt by emergency rooms by building up our primary care workforce as well. Mr. Speaker, there's a lot of work to do. We're going to continue to do it, and we're not going to stop.
Member for Courtney Comox.
Mr. Speaker, Lillooet Hospital has had its emergency department closed for 26 days. Does this Premier think it's reasonable for the good people of Lillooet to drive over 2 hours on snow-covered highways to reach Royal Inland Hospital in Kamloops? Why does this Premier expect people to risk their lives to access basic emergency care?
Minister.
Thank you, Honourable Speaker. I had the opportunity to speak recently with Mayor Hopeful from Lillooet and really appreciated her observations and shared with her the concerns that she expressed to me. As the former mayor of a small town, I can certainly understand and empathize with how challenging it is and the kind of anxiety that it creates for people when hospitals are closed. I also had an excellent conversation with her about some of the work that she and other rural mayors and leaders are doing to help us in our goal of attracting more physicians, bringing more healthcare workers into small rural communities, which, Mr. Speaker, are fantastic places to live. That's why, because we know of particular shortages in these communities, we launched the Provincial Rural Retention Incentive Program to provide bonuses for people who are living in small communities to attract more workers to come to these communities. Mr. Speaker, this is just one example of the kind of work that we're doing so that we can continue to build the workforce so that we are able to have that strong healthcare system, a strong emergency department system in communities large and small across British Columbia. Thank you, Mr. Speaker.
Member for Cariboo-Chilcotin.
Thank you, Mr. Speaker. Cariboo Memorial Hospital has had 18 days of emergency closures over the past year. Mr. Speaker, can the Premier explain how many hours of travel are acceptable when an emergency room closes in rural British Columbia?
Minister of Health.
Thank you, Honourable Speaker, and thank you to the member for the question. And again, I will emphasize the work that we are doing to build up the workforce and to ensure that hospitals like in Quesnel and Williams Lake and other areas in the member's riding and nearby are not experiencing these kinds of diversions. Mr. Speaker, we're going to continue that work. And by providing that kind of support, we know that we can build the workforce in these hospitals, that we can work with communities, with health authorities who do absolutely everything possible, working with physicians and emergency room nurses, working with local workforces nearby to ensure that as many shifts as possible are covered. Mr. Speaker, there are times when there are shortages, when somebody is ill, when they are not able to cover a shift. Health authorities are doing everything possible to avert those closures and then working with BC Emergency Health Services to ensure that ambulances and paramedics are in place to help with that travel assist. Thank you, Mr. Speaker.
Prince George Mackenzie.
Mr. Speaker, the Mackenzie Hospital has been closed 13 times so far in 2025, and it's only the end of February. A simple question to the Premier: does he believe that Northerners deserve quality health care?
Minister.
Thank you, Honourable Speaker, and thank you to the member for the question. Every single British Columbian deserves health care, the access to our universal and public healthcare system here in British Columbia. We're going to continue to take these actions that I'm describing today to build the workforce, to strengthen the healthcare system, to ensure that our public healthcare system is there for British Columbians when and where they need it.
Member for Langley Willowbrook.
Mr. Speaker, 100 Mile House District had its ER closed for 10 days. Royal Inland Hospital is 2 hours, over 200-kilometer drive. Mr. Speaker, why is the Premier forcing people to drive for hours for emergency care?
Minister.
Thank you so much, Mr. Speaker. Yeah, again, like provinces and other communities across Canada, we are experiencing healthcare worker shortages that have caused strain on the system, and yet every single day these doctors, these nurses, these healthcare workers are showing up delivering the best care possible for people here in British Columbia, and I think they deserve our thanks. So, Mr. Speaker, of course, we are going to continue this work, and we are seeing positive trends. Mr. Speaker, we do know that emergency room diversions and temporary closures have reduced by 40% over the last 6 months compared to the 6 months before. Is there more work to do, Mr. Speaker? Of course there is. And I'm sure we're going to canvass this throughout today. We are going to continue this work, and I'll continue to talk about all of that work that needs to be done. Thank you.
Member for Surrey Serpentine River.
Clearwater's Dr. Helmkin Memorial Hospital is an hour and a half away from Royal Inland Hospital. This Premier forced those needing emergency care to drive that distance on 9 separate days this year. Why does this Premier put people's lives at risk?
Minister of Health.
Speaker, and of course, nobody wants to see this happening, and that's why we need to continue these efforts, to do these efforts collaboratively, collectively, to continue working with healthcare workers, with the Doctors of BC, with the College of Physicians and Surgeons, with all of the organizations, with communities, to do everything that we can to build up this workforce, to attract more doctors. Mr. Speaker, this is one of my top priorities, and I know the members have read my mandate letter, Honourable Speaker, and they have seen that this is a top priority for this government. We did not get into this problem overnight, Mr. Speaker, and it is going to take time to resolve, and we are going to continue to do everything we can to lift up and respect our healthcare workers who are doing everything that they can under difficult circumstances. Mr. Speaker, this work is not going to stop.
Member for Abbotsford Mission.
Mr. Speaker, Mission Hospital ER was closed on 7 different occasions. Why does the Premier think that their emergencies are not important enough
to have a local ER open.
Minister.
Thank you, Honourable Speaker, and thank you to the member for the question. Every single British Columbian deserves this access, and we know it, and we all want to see it. That's why we're going to continue our work, building the workforce, attracting more doctors, training them here. Mr. Speaker, expanding the number of seats in the UBC Medical School, building a new medical school in Surrey, because we know that when doctors are trained here in British Columbia, over 90% of them, Mr. Speaker, stay here in British Columbia. That's what we're going to do to build up this workforce to ensure that we have the doctors in place for a strong primary care system and for strong emergency rooms too.
Member for North Island.
Fort St. James had its ER shut down for 6 days by this Premier. The ER at UNBC Hospital is 160 kilometers away. Why is this Premier forcing them to take a 2-hour ambulance ride to an open ER?
Minister.
Thank you, Honourable Speaker, and thank you to the member opposite again for the question. And again, there is work to do, and we are doing that work. Mr. Speaker, we have tripled our capacity for credentialing international doctors. Mr. Speaker, we're working with the College of Physicians and Surgeons to ensure that doctors moving to British Columbia from other provinces in Canada can get their temporary licensure immediately, and that doctors who want to move here to British Columbia from comparable jurisdictions like the US or the UK receive those provisional licenses within 6 weeks. Mr. Speaker, when somebody comes to British Columbia to practice medicine, we want them to be on the front lines. And that's why we're doing this work. We're going to continue to do this work so that we can build a strong healthcare system and make sure that these emergency room diversions are lessening, and we've got more work to do. We're going to continue doing it. Thank you, Mr. Speaker.
Member for Columbia River Revelstoke.
Mr. Speaker, the Slocan Community Health Centre ER is over 2 hours from Queen Victoria Hospital and 4 hours from Kelowna General. Its ER was closed for 5 days. Why does this Premier expect people to drive through dangerous mountain passes to get emergency care?
Minister.
Thank you, Mr. Speaker, and thank you to the member for the question. And again, another example of small communities and needing to know that those emergency rooms are there for people when they need them. Mr. Speaker, there are so many people who are working so hard to do everything they can to avert these kinds of closures. And when they need to happen, because of staffing shortages, Mr. Speaker, because of illnesses, because of the need to continue to build this workforce, Mr. Speaker, we are going to continue to do this work. I understand, as a member of a small community myself, I live in Tofino. We are so fortunate to have a hospital there, and I can imagine what it would feel like for my community members to know that they cannot go to the emergency room in Tofino, that they would have to drive all the way to Port Alberni. Mr. Speaker, I understand how challenging and difficult this is for people, and that's why I am so personally committed to ensuring that this work is done and that we can make progress as we already are. Thank you, Mr. Speaker.
Member for Kelowna Lake Country and Coldstream.
Arrow Lakes Hospital ER was closed for 5 days. Why did this Premier force those in Arrow Lakes to drive for hours to get emergency care on 5 different occasions?
Minister.
Thank you, Mr. Speaker, and thank you to the member for the question. And again, it's hard for anybody in any community to know that their emergency room is not available to them. They want to know that that care is there when they need it, when it's most urgent in their situation. Mr. Speaker, that's why we're going to continue the work that I've been speaking about this morning. Mr. Speaker, we're not going to stop this work, but we're also going to continue to do other things to build out the healthcare system in ways where people do not have to rely on emergency rooms as much. Mr. Speaker, that includes things like connecting more people to family doctors, where again we are seeing successes, Mr. Speaker, with people, almost 700 people a day now being attached to a primary care physician. to remove or to lessen the likelihood of needing to go for non-urgent care, non-emergency care to the emergency room. But, Mr. Speaker, we're going to continue this work, continue to build out the number of doctors, nurses, healthcare workers across the entire system to build that strong public healthcare system that British Columbians deserve.
Thank you. Member for Peace River North.
Mr. Speaker, last year in the Peace region, all 4 ER rooms closed on the same date, forcing people to have to drive up to 10 hours to seek critical care. To the Premier, when, and I'd like to hear a date, is he going to address the closures of these critical services that are happening over and over in rural BC?
Minister.
Thank you, Mr. Speaker, and thank you to the member for the question. We are seeing progress. We do know that the number of emergency room closures have come down 40% over the last 6 months. That's a product of the work that so many people are doing to minimize the likelihood of this having to happen. And again, health authorities, physicians, nurses, nobody wants this to happen, and that's why everybody is taking every step possible to avert these kinds of closures. But it is going to take all of us, with the actions that we've outlined, that I've been canvassing today, by the investments that we're making in new hospitals in rural British Columbia as well, so that people have that top-notch care, the care that they deserve here in British Columbia.
Member for Skeena. Member for Skeena.
Thank you. 800 hours Kitimat's ER was closed last year, and that's just between January and September. Why does this Premier think it's okay to force my constituents to drive hours on snow-covered highways to access an ER?
Minister.
Thank you, Honourable Speaker. And I was really privileged to be able to visit the members' riding back in January and participate in the opening of the new Kasian Regional Hospital in Terrace. This is an absolutely phenomenal facility that is providing care to people in the region, including people in Kitimat, when the emergency room in Kitimat has not been able to be staffed and when diversions have taken place and people have had to come up to Terrace. Mr. Speaker, I know how hard that is on people. I can well imagine it because of where I live too, Mr. Speaker. That's why we're going to continue to do this work. We're going to continue to do things like building the hospital that we've done in Terrace by undertaking all of the work to hire new workers in hospitals. And Mr. Speaker, we are making progress. We're going to continue this work because, as we can see, canvassing all of these questions today, it is extremely challenging for people no matter what size of the community they live in, and that's why we're going to continue this work. Thank you, Mr. Speaker.
Member for Peace River South.
Mr. Speaker, BC's North needs proper ER access. Masset on Haida Gwaii deserves proper ER access. Chetwynd, Tumbler Ridge, and Dawson Creek deserve proper ER access. Why did this Premier close their ER doors?
Minister.
Mr. Speaker, thank you so much, and thank you to the member for the question. And yes, in Masset or in Fort St. James or in Terrace or in Fort St. John, no matter where you live in British Columbia, you need access to care when and where you need it. Mr. Speaker, that's why we're going to continue this work. We're going to continue investing in rural communities, building new hospitals, building new clinics with health authorities, continuing that work to train and hire more doctors, more nurses, more healthcare workers. We are making progress, Mr. Speaker. There's an incredible amount of work more to do. I know that everybody in this House recognizes that, and I am sure that every single person is dedicated to continuing to support their communities, their health authorities, and that we can do this work together. Thank you.
Member for Delta South.
Thank you, Mr. Speaker. Delta residents had their ER closed for 2 days last weekend and possibly this weekend as well. They are being asked to go to Surrey, where wait times are as high as 18 hours. Are Delta residents supposed to accept that ER closures are the new normal?
Minister.
Thank you, Honourable Speaker, and thank you to the member for the question. Again, these are very, very challenging situations for people. And when the emergency room closed in Delta last week, it was really hard for people to take. And I spoke to the mayor myself as well, and we had a good conversation about some of the challenges that are being experienced. And he certainly reflected the concerns that he is hearing from his constituents. Mr. Speaker, that's why we need to continue the work that we're doing. And we're not going to stop. We know that we need to attract, hire, retain more emergency room physicians, more family doctors to alleviate the pressure, to continue to expand the UPCC network, the Urgent and Primary Care network across British Columbia, to alleviate that strain on emergency rooms. Mr. Speaker, we're going to continue that work.
Member for Penticton-Summerland.
The South Okanagan General Hospital emergency room saw 40 days of closures this year. To the Premier, how many ER closures are enough before this government takes action?
Minister.
Thank you so much, Honourable Speaker, and thank you to the member for the question too. Again, no matter where you live in British Columbia, knowing that the emergency room is there for you when you need it is of utmost importance. It's very difficult, even when you don't anticipate having an emergency, to know that something you've depended on for years and years and years is being challenged. These are strains that are being felt across the healthcare system nationally and even further. Mr. Speaker, that's why we have to continue the work that we've been doing. Mr. Speaker, that's why it's promising that we're seeing initial results, but we're not going to let up. We've got to continue this work so that we can ensure that everyone living in British Columbia, no matter whether a small community, a large community, has access to the health care that they need when they need it.
Member for Kootenay Rockies.
Thank you, Mr. Speaker. Elkford's ER department in my riding has been closed for over 2 years. 2 years. Why did the Premier do nothing to prevent Elkford's ER from closing?
Minister.
Thank you, Honourable Speaker, and thank you to the member for the question. And again, if you live in Elkford or Sparwood or Fernie or anywhere out in the southeast Kootenays, you need to know that the emergency room is there for you and that our healthcare system is here for you. Mr. Speaker, healthcare workers are doing phenomenal work under very challenging conditions right now. And I think it's important that we remember that this is difficult on them as well. Mr. Speaker, that's why we have to continue this work of attracting more doctors, of building out nursing shortages, of ensuring that we have all the healthcare workers across the entire system that we need. Mr. Speaker, that's why for small communities like this, the Provincial Rural Retention Incentive has helped to bring new people into communities. Mr. Speaker, we're going to continue these programs. We're going to continue this work because we know it's,
Thank you. Thank you, Minister.
It's what has to be done. Thank you.
Member for Prince George Valemount.
Mr. Speaker, the hospital in Creston Valley has also closed and is vital for the community. So again, why does the Premier continue to close ER services for those in crisis?
Minister.
Thank you, Mr. Speaker, and thank you to the member for the question. And again, any person living in a community where an emergency room that has been open is now closed temporarily or for longer in some cases, it's an extremely stressful situation and creates a lot of anxiety. I recognize that. We all recognize that. That's why this work has to continue. And also, Mr. Speaker, that's why in the situation like this, when this happens, it's why it's so important to work closely with the BC Emergency Health Services, of course, and ensuring that paramedics, ambulances know when a diversion is there, because we want, of course, to ensure that people get to care as quickly as possible when they need it. But, Mr. Speaker, it's also why we're continuing to build out our primary care system, ensuring that people have access to other treatment, to reduce the likelihood of needing to go to an emergency room for non-emergency care in the first place. Mr. Speaker, we're going to continue this work.
Member for Surrey White Rock. Member for Surrey White Rock.
Thank you, Mr. Speaker. I would say the last 30 minutes have been a pretty damning indication on the state of our healthcare here in British Columbia. Every part of this province has been represented today speaking about the state of our healthcare. Can you imagine having your child, your ailing child, in the back of your car and having to drive 10 hours to access an emergency room department? Shame. That is the state. Can you imagine going to Surrey Memorial Hospital and waiting 18 hours to access an emergency room department? Shame. Shame. When people in this province seek health care, seek an emergency room, they should expect that they're able to get that access when they need it and where they need it. And that is not happening today. Furthermore, when our healthcare workers go into, I'm sorry if this is inconvenient for the members of government, but what's more inconvenient is when you're trying to access an emergency room and it's closed. Yeah. That's inconvenient.
Question, member?
My question is this. Yesterday, I highlighted the fact that we had a horrific incident in South Surrey. That person was then taken to Peace Arch Hospital. And from what we know now, that person actually tried and attempted to take the firearm of an officer in that hospital. That person restrained by the physician. Restrained by the physician.
Question,
so not only, I'm sorry if this is inconvenient. What was inconvenient was for a physician who had to intervene to protect his staff and protect the frontline worker.
Thank you, member.
So my question is to the Premier. When will he wake up and when will he actually stand up for British Columbians for that when they need health care that they can get it, and for the workers, the frontline workers that are in our hospitals, when is he going to stand up and make sure they're protected as well?
Thank you. Members, show some discipline, please. Member from Abbotsford South, member, come to order. Minister.
Thank you, Mr. Speaker. I will stand up for healthcare workers each and every day.
Member, question period almost concluded. If we are done, member, for God's sake, be quiet. Please conclude.
I'll stand up for healthcare workers each and every day, as will every member of this government. Mr. Speaker, we have canvassed many different communities across BC in today's question period. Mr. Speaker, I didn't hear any ideas from the opposition, but one idea I have heard is bringing in a U.S.-style two-tier healthcare system that would poach doctors and nurses from our system and make it worse.
The bell ends the question period.